Hello there, I'm Dr. Duck, and today I'll be conducting your ear examination. So, before we proceed, I'll ask you some questions to record into my computer. Sound good? Okay. So, what's your name? And your age? And can you tell me about the last time you had an ear examination? And were there any problems that arose during that examination? Have you recently had any hearing issues or difficulties? Do you have a family history of such problems? And do you have a personal history of ear infections? And do you frequently listen to loud music, either like in concerts or even just with your headphones? Yeah, I could be a little bit guilty of listening to music too loudly. We just get into it. Have you recently experienced dizziness or any nausea? And on a scale of 1 to 10, with 10 being the best, how would you rate your hearing? And are you currently taking any medications? And do you have any allergies? And is there anything specific you would like to discuss with me today before we get started? Okay. Well, thank you for your cooperation, and well done. Now, we can start with the examination. So, before we begin fully, I'd like to conduct a quick check of your overall health, just to make sure that you're doing generally well. This is to ensure that everything is okay. Okay, is it alright if I touch you? Thanks. I'm going to start by listening to your lungs. Okay? Okay. Take a deep breath in and out. Okay, good. And once more, please. In and out. Okay. And now I'd like to check your heartbeat. Can you continue to breathe normally? Perfect. Okay. Perfect. That is all fine. Okay, so next I'm going to examine your mouth to check your gag reflex and just make sure that your oral hygiene is okay. Okay, so please just open your mouth a little wider. There's nothing to worry about. I'm just going to take a look. Use this little dipstick to press your tongue. Just taking a look. Okay. How often do you floss? Really? Okay, that's good. You can close your mouth now. And now I'm briefly going to assess your eyes. Make sure that you don't have any ocular discrepancies. When was your last eye appointment? Just for the record. Okay. Alright. I'm going to use this little pen light. So, hold your head still, and I'd like you to follow the light without moving your head. Good. Just keep following the light. Good job. That was excellent. Okay, so let me explain what we'll be doing next. Today, I'll be manipulating your ears to gain a better view inside your ear canal. I can assure you that this won't cause any pain or discomfort. So, the parts of your ears that I'll be touching today include the eyelet. At the very top of your ear, there is a small elevation, which is called the eyelet, at the top. And while it doesn't serve any specific auditory function, it contributes to the ear's overall shape. Next, we have the helix. The helix is the prominent outer rim of the ear, curving along its outer edge, and it helps to capture sound waves and funnel them into the ear canal. Next up, we have the ridge that is inside the ear, and a ridge that runs along the cartilaginous part of the ear, aiding in channeling and directing the sound waves further into the ear canal. Next, we have the tragus and the antitragus. The tragus is a small, hard protrusion located in front of the ear canal's entrance, and while the antitragus is located opposite the tragus, makes sense, forming a protective barrier for the ear canal. Next, we have the lobule. The soft, fleshy lobule is the lower, dangling part of the ear, and this is where many people choose to get their ears pierced for decorative purposes. But the lobule doesn't play a role in hearing, but it contributes, again, to the ear's overall structure. So, as a medical professional, I'll be manipulating these various structures, and I'll be doing this to gain a better view inside your ear canal. This procedure is typically done to examine the ear canal, the eardrum, and to perform procedures like earwax removal. So, if you're ready, we can proceed. Please relax, and I'm going to use an otoscope, which has a magnifying glass and a small speculum, this thing at the end, to examine your ear canal. So, let's take a closer look. I'm searching for skin lesions such as cancers and hematomas. Let me check behind your ear in the mastoid area. I'm observing the position and size of your ears, checking for symmetry, looking for any discharge, or swelling, or redness. Okay, that looks fine behind your ear. So what I'm going to do is gently pull the auricle, the external part of your ear, up and back. And if you were younger, I'd be pulling it down. But as you are an adult, it's up and back. I will then insert the scope into your ear. And if it's uncomfortable at all, just let me know. But this should be fine. It'll cause you no pain at all. Okay, let's take a closer look. Okay. And while I examine the tympanic membrane, which is just a fancy word for eardrum, just taking a look. Okay. So, there appears to be quite a bit of cerumen in your ear canal, and cerumen is just a fancy word for earwax. And with the level of cerumen that you have in your ears at the moment, I cannot make a proper assessment and state the health of your tympanic membrane. So, if I can't see it, I'll need to clean it. So, this may be a little bit uncomfortable, but I assure you I'll do my best to make this painless and minimize any discomfort. So, I'll be very gentle. But I do need to clean this out, because if I don't, I won't be able to assess your ears. But then also, if the cerumen is left there, it can become impacted on your tympanic membrane, which could lead to hearing loss or pain or just general discomfort. So, before we get into that, I'm going to check the health of your other ear and see if the same treatment is needed. Okay, so just relax, and here we go. Pulling up on the auricle and back, inserting the scope and turning on the light. Okay. So, you also have a significant amount of cerumen in your other ear, which I will need to remove to see the eardrum clearly. So again, I'll try and be as gentle as possible, and hopefully you won't feel a thing, but you may hear some picking sounds. But here's what I'm going to do. I'll remove the excess cerumen with some tweezers. Other doctors use different methods to clear excess cerumen, but this is how I'll be doing it today. So, just relax, take a deep breath, sit still, and just keep me informed of how you're feeling. Let me know if you're experiencing any pain or discomfort, but hopefully there'll be none of that. So here we go. Just going to use my forceps to clear out your ear. Just wiping it off as I go along. You're doing great. It seems to be coming out just fine. Some people just naturally produce excess earwax and need to get their ears cleaned out more regularly, which is quite alright. Cerumen or earwax is just a waxy oil-like substance produced by the hair follicles in your ears. It's actually very useful. It protects against dust, particles, water, and bacteria and fungi that can lead to infections. So it's very beneficial. However, excessive cerumen is a common cause for hearing loss due to a blockage or on the eardrum. You doing okay? We're almost there. I understand that the tweezers may sound quite loud, but I do say this is working very well. And we're getting lots of wax out, and you're going to have squeaky clean ears. Of being very careful not to damage the delicate skin inside your canal. Want to avoid creating any areas of irritation or small lesions in your canal. Okay. So now I'll use the scope again and we'll see how we've done. Okay. So auricule goes up and back and the scope goes into your ear canal. Alright, let me see. Alright, well, that's much better. I'll examine the tympanic membrane now. I'll note the colour, position, and the contour. Okay. Okay, very good. You have a very healthy eardrum. Good. That is excellent news. Alright, now let's clean up the other side, shall we? Again, going in down with the tweezers. Everyone has delicate skin in their ears, so it may seem like I'm doing a lot, but I'm just trying to be as meticulous and careful as possible. Removing little pieces at a time and getting them all out. You're doing very well. These tweezers may sound loud because they're right next to your tympanic membrane. But the work we're doing is very delicate. Sometimes I need to scrape a little bit of wax from the canal if it's being stubborn. But for you, the pieces are coming out quite nicely, and I don't want to damage your skin. Good job. Alright, let's check that out again. Auricle goes up and back, and the speculum goes in. Okay, let me see. You can see your tympanic membrane. Okay, it looks very healthy. I've noted the contour, colour, position. There's no discharge or flakiness. Okay, I'm taking the scope out. That wasn't so bad, was it? You've been very patient with me. So, lastly, I'm going to assess the mobility of your tympanic membrane. I'll be doing that by making some small puffs of air with this little pump. And I'll be observing how your eardrum reacts. Okay, good for that. So, start at this ear. Should feel like someone's blowing air into your ear. Okay. Is that feeling okay? Okay. Good. Let's try the other ear now. Okay. Auricle goes up and back. My apologies if it tickles a little bit. But you're doing very well. Excellent. Both ears are doing impeccably. So, I'm down to a hearing test. I'm going to make some noises, and you'll have to tell me if it's coming from your left or your right ear, or both. and if you notice any differences or unevenness, okay? Alright. Good. Good, correct. Mm-hmm. Okay. Did one side seem louder than the other, or were both the same? Okay. Okay. Try one more time. How did that sound? Mm. So, for the next test, I'll be saying some words in either your left or right ear, and I want you to repeat it back to me. Okay? Here we go. Box. Star. Chestnut. Map. Speaker. Train. Blue. Pylon. Shutter. Crisp. Lobster. Jade. Albert. Butterfly. Terrace. Shelby. Duck. Quack. 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 Good job. Oh, you did very well with that. So, one more thing. I'll be raising my fingers together, rubbing them like before, but I'll be moving them away. And when it passes out of your field of hearing, let me know, okay? Let's begin. Okay? Okay. Good job. Okay, just to be sure. Very good. You did excellent. So, let's talk about earwax. It seems like you produce quite a bit of earwax on your own, which is common. Many people use Q-tips to clean their ears, but I would not recommend. Using Q-tips can actually push cerumen deeper into your ear canal, making it harder to remove. And you can push it in to the point where the wax becomes impacted. And so, even if you use a Q-tip and you see some wax on it, it may have only pushed the cerumen further inside. So, I would recommend that you avoid inserting Q-tips into your ear canal. Instead, just let the earwax naturally migrate out, and if it becomes impacted on your eardrum, it can become very painful and challenging to remove. So, regular cleaning should help prevent this issue, and I would suggest making an appointment at the desk before you leave in about, say, 5 months from now for another ear examination. And that way you can just see me again, and as you know, it's just a simple procedure to clean out the excess earwax and to keep your ears in fine tip-top shape. Sound okay to you? Okay. Well, if you have any questions, please ask my associate at the front desk, and I'll see you in a few months. Alright, don't forget. Okay. Yep, you can get your coat, and once you're all ready to go, you can head on out. Have a great night. Bye-bye.